when you're ready.
Thank you, chairs and members. Sean Rundle, Government Affairs and Public Safety Specialist for the California Peace Officers Association, or CPOA, who is also, with the rest of my colleagues here, with the Coalition for Responsible Drug Policies. The CPOA was founded in 1921, and we represent the interests of nearly 3,000 officers of nearly every rank of law enforcement in California. Since the recent provisions of this measure have come to light, our members have been providing feedback on the nature of marijuana crimes and the public safety effects. So this afternoon, I'd like to be brief and very brief about and share with you some of these facts and law enforcement perceptions on how the AUMA would burden public safety. In terms of arrests and the perceived war on drugs, the fact is that across California, incarceration for marijuana possession is down significantly. We've heard this from both county corrections and the CDCR, who are currently spending $0 annually on incarceration of persons found in simple possession. But what has remained steady and will only increase in our perception, as it has in Colorado and other states, is the frequency of marijuana-related crimes. So it was discussed before. We want to talk about some of the violent and serious crimes, so let's talk about the violent and serious crimes. Sacramento County, for example, has reported that during a period from May 1st, 2015 to May 1st of this year, 4 homicide cases with 6 victims linked to marijuana, specifically escalations of home invasions and burglaries. During that same reporting period, 28 persons were armed for a marijuana offense. Various peace officers I've spoken to throughout the state have agreed that it is almost a certainty that cultivation provisions under this measure will only increase the number of home invasions in the state as well as the violent crimes that are associated with them. Officers have assured me that perpetrators of these crimes, whether they be gang affiliated or not, are getting smarter and more resilient and even using social media and other networking platforms to find their next targets. What should be noted, with the expected public safety costs increases that law enforcement agencies would come for this measure would become reality. You heard a little bit about what monies would go to local law enforcement, but the burden about how they will, their costs will outweigh those reimbursements, but also the burden on the administrative enforcement of these provisions. In over 70 responses to a survey of various police departments around the state, 94% of agencies concluded that marijuana enforcement costs would either remain the same or increase if the initiative were to pass. Some agencies reporting between $100,000 to $1 million for administrative costs, additional officers, code enforcement. The reported costs that they responded to include, among some others, emergency responses, criminal complaint intake, school enforcement, increased transient population response, forensic testing, gang control, compliance checks, and training costs. In summary, the AUMA provisions will undoubtedly burden keepers of the peace in California, both in costs and enforcement. States like Colorado have shown us that the legalization did not have the desired public safety impacts that it had anticipated, and it has, in fact, increased crime. Prohibiting persons from using, in the public does not enhance public safety because it does nothing to prohibit the use in private and then venturing into the public and possibly causing harm. It's not that law enforcement will have to forego responding to more serious crimes. It's that they will have to continue to do that and respond to these marijuana-related crimes as it is more widespread. The licensing and regulatory framework proposed by this initiative will not keep marijuana-related crimes from occurring in California, and we must not repeat the mistakes of others. Thank you.
Thank you. Thank you for your testimony, and thank you for sticking to the time limit. Appreciate that. Let's move on to Lauren Michaels with the California Police Chiefs Association.
Thank you.
Ms. Michaels.
Thank you. Good afternoon. My name is Lauren Michaels, and I am the Legislative Affairs Manager for the California Police Chiefs Association. In this role, I've had the pleasure of working with a wide variety of stakeholders to develop a statewide regulatory structure for medical marijuana. This multi-year effort hit a high point last year when the governor signed the Medical Marijuana Regulation and Safety Act. Hailed as consensus legislation, MRSA had the support of local law enforcement, local government, labor, patient advocates, and the cannabis industry. By proposing a parallel, conflicting structure for recreational marijuana use, the AUMA weakens regulatory framework of hard-fought provisions found in MRSA, such as complete and absolute local control, limits on vertical integration, and strict controls on deliveries. Included in the MRSA were provisions that gave ironclad protections for local control with respect to medical marijuana. These provisions included a right for any jurisdiction to ban any and all phases of medical marijuana activities, including indoor cultivation of marijuana. By contrast, the AUMA specifically prohibits local governments from banning indoor cultivation of marijuana. There is no better way to ensure a robust, unregulated, untaxed gray market than to allow for widespread home grows. Furthermore, any plant count touted by the proponents of this measure is absolutely unenforceable by local law enforcement and really irrelevant. Law enforcement will only be able to ensure compliance by responding to complaints or with established probable cause. In fact, 94% of police chiefs in California anticipate that local enforcement costs will increase or stay the same should the AUMA pass. The MRSA also provided that no state license shall be issued unless a local permit or license is issued by the jurisdiction in which the business proposes to operate. The dual licensing provisions in MRSA ensure that the issuing or revoking of a local license or permit is just as impactful as the issuing and revoking of a state license. In contrast, the AUMA explicitly states that an applicant need not provide documentation to the state that the applicant has obtained a local license, permit, or other authorization. Jurisdictions without local ordinances regulating recreational marijuana will essentially cede local control to the state. Under MRSA, limited vertical integration is permitted, and statewide cultivation per applicant is capped at 4 acres statewide, subject to local ordinances. Furthermore, MRSA creates a firewall around distributors and transporters, prohibiting these licensees from holding a license in other categories. These firewalls were built to reduce diversion, ensure that the final products were accurately tested, and prevent tainted product from being sold to consumers. Like local control, these provisions have been cast aside by the drafters of the AUMA, replaced with a model that allows licensees to apply for numerous license types and amounts of those licenses, paving the way for seed-to-sale control of the market. A February 2016 analysis of the Adult Use of Marijuana Act conducted by UC San Francisco's Center for Tobacco Control Research and Education finds that the AUMA was written primarily to create a new business and only includes minimal protections for the public that are unlikely to prevent public health harms caused by the growing industry. The discrepancies between MRSA and the AUMA tilt the scale in favor of an industry poised to profit at the cost of thoughtful legislation that established a balance between California's communities' ability to preserve influence over medical marijuana distribution within their borders and the right of California's citizens to access medical marijuana as provided for under Prop 215. As the legislature and the governor's office continue to revise and fine-tune MRSA, the discrepancies grow wider. Under the governor's trailer bill, as we heard earlier, the Department of Public Health will have express authorization to stop the distribution of medical cannabis products that have been adulterated or misbranded, a power solely needed as California begins to regulate edibles. DPH would not have these express authorizations to regulate recreational marijuana should the AUMA become law. In fact, the governor's trailer bill language places medical cannabis testing under the Bureau of Medical Cannabis Regulation, not the Department of Public Health like the AUMA. When compared to MRSA, the AUMA creates a duplicative, costly, and contradicting structure that simply comes up short of being considered a real regulatory structure.
Thank you. Thank you for your testimony. Let's go ahead and move on to Mr. John Lovell with California Narcotics Officers Association, responsible drug policies.
Good afternoon. My name is John Lovell. I'm with California Narcotic Officers Association. I'm associated with the Coalition for Responsible Drug Policy, which is the wide and diverse group that's come together to oppose this measure. I think what's important to do is to focus on the actual content of the ballot measure, because that's really what's before voters. And we had this obtained in 2010 as well, where even people who perhaps in their own philosophical view of the world felt that marijuana should be decriminalized found specific provisions of the ballot measure objectionable, and it was, well, you know, I want to make a change, but not this change because the price is too high. And I think there's some examples here, and let me just talk about 3 of them. First one, if you look at section 26057B5, it is truly one of the most remarkable provisions I have seen in any marijuana legalization measure. What this provides is that the fact that someone has been convicted of selling, manufacturing, transporting, or cultivating any controlled substance, okay, not just marijuana, but any controlled substance, under the provision of AUMA, they cannot be denied a license on that basis. So, you have someone who is dealing up to a kilogram of China white heroin, okay? That's enough for 20,000 doses of heroin. They cannot be denied a license. A cocaine dealer or a meth dealer convicted of selling 10,000 doses cannot be denied a license. Now, unlike MRSA, where if you were convicted of certain crimes, you had to show rehabilitation, you had to show other ameliorative behavior, this turns that on its ear. In other words, rather than being a disqualifier, being a convicted drug dealer under this measure is a resume builder, folks. Because it gets
Mr. Lovell, if I can, I know the LAO reported on some of this, and they did specify it was for marijuana-related crimes.
No.
So I'd like to see that provision if you, you can provide that to the committee.
All right. Except as provided in subparagraphs D and E of paragraph 4, and notwithstanding Chapter 2 of 1.5, a prior conviction where the sentence including any term of probation, incarceration, or supervised release is completed for possession for sale, manufacture, transportation, or cultivation of a controlled substance is not considered substantially related and shall not be the sole ground for denial of the license. And that is section 26057B5. So this is much broader than anything that has appeared anyplace else. Another point that was made by the proponents, they indicated that dealers who were using children in drug trafficking could not get licenses. But what they didn't tell you is that the initiative artfully restricts the definition of using children. It's restricted to using children in your drug dealing business in order to have those children sell drugs to other children. Now, as the San Diego District Attorney's Office pointed out in their recent white paper on this measure, that's not what dealers use kids for. Dealers use kids as couriers to take a stash from to an adult buyer. Dealers use kids as lookouts. So the dealer who uses kids in the normal business practice cannot be denied a license on that basis. This is a provision that is truly remarkable, and it is unique. Second point I want to make is the drugged driving provisions of the bill. Now, we know that marijuana legalization in the other states has increased traffic fatalities that are THC related. In Colorado, gone up 44%. In the state of Washington, it's gone up over 100%. This measure simply punts the issue to a 4-year study. That did not impress the California Highway Patrol Association yesterday, who met on this issue. They voted overwhelmingly to oppose this measure, saying that it would not make the streets safer. Finally, proponents of the measure keep talking about regulation, about how, we're going to put a regulatory net around this whole provision. Okay, what they didn't tell you is hidden in the language is something called regulations that are unreasonably impracticable. You ever seen this in any other statutory scheme? I certainly haven't. It means that the measures necessary to comply with the regulation require such a high investment of risk, money, time, or any other resource or asset that the operation of a marijuana establishment is not worthy of being carried out in practice by a reasonably prudent business person. This, folks, is an invitation for high-priced lawyers to sue to vitiate any regulation that is promulgated. Oh, and one other thing. The
If you
measure.
can wrap up, Mr. Lovell, please.
Pardon me?
If you can conclude, start concluding.
It's my last sentence,
All right.
actually.
Thank you.
The measure provides for an advisory committee stacked with industry members, as UCSF study pointed out. And guess what? One of their jobs is to identify these unreasonably impracticable regulations. This is sham. Every single regulation is going to be subject to legal challenge, and the measure invites it.
Thank you. Thank you for your testimony. Let's go ahead and move on to Ms. Connie Delgado with the California Hospital Association.
Good
Please.
afternoon, Mr. Chair and members.
Thank you.
Connie Delgado with the California Hospital Association. I want to thank you for the opportunity to testify regarding the Adult Use of Marijuana Act. Members, CHA, the California Hospital Association, supports an optimally healthy society, and we do not believe that allowing the recreational use of marijuana supports that vision. Conversations with our counterparts in the Colorado Hospital Association have revealed that after the passage of their initiative, the hospital saw an increase in emergency department visits. In addition, the hospital also saw that the rise of homelessness in that state took a dramatic turn. Hospitals also experienced an increase in babies who tested positive for marijuana, and we want to just acknowledge that given the public health concerns, we believe that California should not move forward with this initiative unless we have more information from Colorado and Oregon. At this point, it is too early. California hospitals are committed to providing the very best care for the patients and the people of the state of California, and for those reasons, we do not support this initiative.
Thank you. Thank you for your testimony and for your briefness. Please, let's move on to Bishop Ron Allen with the International Faith-Based Coalition. Please.
Thank you very
proceed.
much. As you can see, I don't need notes. I live it every day with in a drug-riddled community. I've been a pastor since 1984, and I want to assure you that all youth are not smoking marijuana. But how can our youth say no when the adults around them are saying yes? They just can't say no. Lower the expectation of the penalty of consequences for any drug, and the use will go up. And that's exactly what we're seeing. I wish that you can walk my neighborhood, because I can assure you, the day that marijuana is legalized in the state of California, you all are going to get high. You're going to smell it, and you're going to get high from the secondhand smoke. If you've never been high before.
Well, let's not make that assumption, but please proceed.
I'm sorry. Don't want. Because we smell it every day. Mm-hmm. We smell it coming out of church. We smell it coming out of the stores. We smell it coming out of the schools. We smell it in the parks. And I can certainly tell you, the dispensaries, they're not in Los Gatos. They're not in El Dorado Hills. Come to my community and see the liquor stores on every corner. And I can promise you, the same identical thing is going to happen, because history has stated it. History repeats itself. The stores that will open up in my community. And not only will I see a liquor store in every corner, but I will see a pot shop or pot being sold in every corner. That's something that we don't need. We have enough difficulties and enough problem. L.A., I wish the senator or the assembly member would have stayed, because you're absolutely right, sir. The target is the underserved community right now. Do the research. And, oh my God, we thought that if you legalize marijuana, the disparities of arrest will go away. We were so happy. The African Americans, the Latinos, we were happy. But then we took a look at Colorado, and they went up 58% for the African Americans, 29% for the Latinos, and dropped 8% for the whites. Well, okay, somebody said, well, that's just Colorado. Well, okay, how about Washington? All went up. It's the reverse. So if you legalize marijuana, the disparities of arrest, they don't go away, they increase. And in fact, for the record, how in the world could legalizing marijuana be a civil rights? I guarantee you, Martin Luther King must be turning over in his grave. Who in the world would want to keep the blacks and the Latino and the poor whites high, lethargic, broke, and disgusted? And my last saying, I got a call from the Urban League, the president of the Urban League, some time back. And that gentleman said to me, Bishop Allen, we're doing a really good job with our youth. We're training them how to interview. We're training them how to dress. We're training them how to talk. And guess what? They're going out and they're getting the job, but they can't pass the drug test. He said, tell me which drug is in their system. You want me to blame the youth? Or should I blame the adults that are saying to the youth, it's okay to smoke, it's okay to get high, and we're going to legalize it? I'm asking you, make a day and come with me. And I promise you, on that day you'll change your mind. And you'll see that alcohol isn't any good, tobacco isn't any good, and marijuana isn't any good. What would you rather for me to give you, a cobra or rattlesnake? Thank you.
Thank you. Thank you for your testimony. And just for clarification, in this hearing, we're discussing the initiative. We have no authority to change the language in the initiative. I'm sure we'll hear all these different points from both the proponents and opponents over the next 5 months as the California voter will decide in November. So with that, let's go ahead and move on to our next panelist, Ms. Carla Lowell with the Citizens Against Legalizing Marijuana. If you can proceed, please.
Thank you, Mr. Chairman and members of the committee. I represent parents and grandparents and citizens around this state and across the country, maybe over 90%, who don't smoke, who don't want to use marijuana, who don't want to eat it, who don't want to vape it. This act will welcome cartels to legal, homegrown THC black market, with the potential for obscene profits, all on the backs of our children, our communities, our environment. No amount of taxing or controlling or regulating will change the THC. That's the tetrahydrocannabinol. That's all this discussion is about, is the THC. It will not change the THC, which is highly potent today, fat-soluble, mind-altering, that is doing the damage to our kids' developing brains. To put this into perspective, down to really what we're talking about, I have here 6 baggies of parsley. Each one represents an ounce. There are 16 ounces in a pound. At the local pot shop down the street, an ounce, and in the material I brought you are some examples, this might sell for $316 an ounce. If I, in my home or my apartment, as this indicates, I can grow 6 plants. Assuming I grow 1 plant of marijuana, and a plant can yield anywhere from 1 to 5 pounds, assuming I just grow a plain old basic little plant, that can be worth $5,000. If my husband and I are 2 people in a home or an apartment, smoke 2 joints a day, 1 every day for the year, they will effectively, if they grow 6 plants of marijuana, they will effectively have about $25,000 to give away, because they will only need about 1 and maybe a quarter plants of yield to satisfy their need, whether it's, quote, medical or for recreation. We don't need any more marijuana in California. We have got 50,000 illegal grows currently. Do you know how much water a plant requires? About 6 gallons of water. Every single negative in California in life is exacerbated. We do not need, it is not right. This initiative says make it right. It is not right to have more marijuana. It is not right to have more kids smoking pot. It is not right to have more kids losing points of IQ that's irreversible. It is not right to have more kids dropping out of school. It is not right to have more crime, gang-related problems with kids. It is not right to have more drug drivers. It is not right to have more pot shops in my friend Bishop Ron's community. I've been there. They're not going to have these pot shops in your communities. Trust me. It is not right to have more death and destruction in our forests, our wildlife. Are you aware of what's happening? I'm sorry we don't have somebody from the U.S. Forestry here to testify. You would be stunned. I agree with Ms. Huffman, who said this is not a war on drugs. She's right. We are in a battle for the brains of our youth. The proponents, the legalizers, the dopers, they want an annuity. We, the moms and dads, the voters will say no to this. We are fighting for safe, healthy, drug-free kids. The future of America is at stake. Thank you.
Thank you for your testimony. Let me go ahead now at this time, open it up for questions from members on the dais. Mr. Quirk.